The healthcare battle continues. Polls showing people worried about the new Republican plan, and so are more and more Republican lawmakers. House Speaker Paul Ryan still says they have nothing to worry about. Then we now know more about Donald Trump's taxes, but what we don't know is a much bigger story. And also, is Chelsea Clinton planning to join the family business and run for office? Some Clinton insiders say yes, she is. Good evening and welcome to RFL. I'm Andrew Whitman in for Richard French tonight. President Trump heading to Tennessee as we speak to help sell the Republican health care plan. He will be speaking in front of a lot of the very same people who could be most hurt by a repeal of Obamacare. The plan he'll be pushing could kick tens of millions of people off the insurance rolls. The nonpartisan Congressional Budget Office says 14 million more people will be uninsured just next year if the Republican plan is passed. It's unlikely the president will mention that, but he's sure to say that Obamacare is a disaster and that it's in a death spiral. Trouble is, it's really not. The CBO, that's the bipartisan scorekeeper for these bills, says the Obamacare markets are stable for the long haul. It also says the GOP plan would make them unstable, at least in the short term. So, of course, it's time to blame the messenger, and here's the vice president talking about the CBO.
What the Congressional Budget Office is good at is estimating income and expenses in various federal programs. What I think they're less effective at is really evaluating what happens in the marketplace.
Now, besides the scary projections about people losing their coverage, the GOP has what appears to be another problem. The people aren't buying what they're selling. Check out this Kaiser poll. Most of the people asked say the GOP plan will result in fewer people getting coverage, and most also say it will result in higher costs. But House Speaker Paul Ryan disagrees. Here he is talking about how everyone has worked together on this bill.
The Senate and the House laid out for the president an aggressive 200-day schedule. We knew we couldn't do it all in 100 days because the Senate has to approve all these cabinet members. So it's an aggressive 200-day schedule that we worked with the president on. He said, I love it.
And if Republicans have been in on the negotiations, Democrats have been left out in the cold. Huffington Post reporting that the White House has not reached across the aisle to speak to any Democrats on this whatsoever. All right, let's discuss this with our panel. We've got a good group of friends here tonight. Jeannie Zaino is with us, professor of political science at Iona College. She is also a senior advisor at the consulting firm Applied Technomics. Next to her, Dominic Carter, political journalist and author. And on the other side of the table, all by his lonesome, Richard St. Paul, Republican strategist, former vice chair for the National Black Republican Association. Rather than let this get into what does the plan do, what does the plan not do, I want to focus entirely on the politics of this all. And you heard Paul Ryan saying, this isn't just me, this isn't Ryan Care. The president was in on this, all of my colleagues in the House were in on this. Jeannie, now that Republicans have embraced health care reform and have a plan of their own, do they own this thing, whether it passes, whether it fails, whether it blows up, whether Obamacare blows up?
I don't know if Paul Ryan missed the march by his fellow right-wing Republicans on Washington today against the bill that he put forward and in favor of complete repeal of Obamacare and then thinking about replacement. But of course, Paul Ryan wants to keep saying that this is all of our doing, this is all of our bill, but he better be very careful because the Trump administration will run away from this bill as fast as he can blink his eyes if for a second they think this thing is going to go under, and they will make the case that it doesn't meet the principles the president laid out before Congress when he spoke to a joint session of Congress. And in truth, it doesn't meet those principles, so the president has every right to run away. So while the president's on board for the moment, he might not be on board for the long term. And certainly we see about half a dozen Republicans in the Senate, including Tom Cotton, who aren't on board. Susan Collins, another one, who may not be on board in the end. So Paul Ryan wants to make the case that they own this thing, but the truth is he and his contingent of Republicans in the House who built this thing own it, and they're going to go down with it if it doesn't pass, and in all likelihood, it's not going to pass at this point, and at least the Senate.
Richard, if it doesn't get through, who winds up getting the blame? Is it Paul Ryan who gets the blame for this? Is it the Republican senators who wouldn't get on board? Or is the president on the hook here?
Well, obviously, there's several steps that we need to go through. First, it's got to get through the House. You need 218 votes to get through the House.
And if they don't have the votes, they're not going to bring it up for a vote. So,
right. Well,
okay.
More than likely, that's correct. That's probably the best thing, because it would be a public relations nightmare if you're going through and you don't get the vote. But let's say it passes the House, then you get to the Senate where you can make additional changes, and then it gets to a conference committee where additional changes, all before it gets to the president's desk. So I think look, we're speculating here whether it passes or not. We know that there's a contingent of Tea Party, the Freedom Caucus, probably about close to 30 members who don't particularly support the bill. The Nobody has reached out to Democrats to support the bill. So
Has not.
I know, have not reached out to Democrats to support the bill. So there may be some midnight quarterbacking, and it may have a possibility of passing, but obviously Speaker Ryan hasn't given up at this point in time. So I think there's a possibility he can get through the House.
Fair enough, and I give you full credit for the disclaimer. Yes, this might not pass the House, or it might still get through the House. Let's say it doesn't. Let's say it doesn't get through the House. President Trump has embraced this thing and is going to make a big rally for it. He campaigned on repeal and replace. How much of this is on him, and how much does it hurt him? And in a second, I'm going to ask Jeannie about past presidents getting involved in health care plans that didn't go particularly well.
Well, we know that. We got to back up to Obama and Clinton, those health care plans. But anyway, look, the president has gone out and said, this is what I'm going to do with the immigration ban, with health care. If it doesn't happen, then I think it's ultimately on Congress. This is what he's put forward. So he has done his job. He said, I'm going to ask Congress to repeal and replace Obamacare. I've done that. Now it's up to the congressional members to carry the water and get that done. So the other thing is the president has tried to get conservatives, invited conservatives to the White House and conservative think tanks and tried to sway their opinion. So he has been pushing forward to this, but ultimately I don't think it lands on his feet if it doesn't pass.
Dominic, to my mind, that almost makes it worse. The president, this fantastic negotiator, you've never seen a negotiator in the Oval Office like the guy we got there now, at least if you believe him through his campaign rhetoric, can't negotiate a deal with Republicans. He's had conservatives at the White House. They're not on board yet. He's got moderate senators who aren't on board yet. How is this not on Trump if this goes down?
Well, because he's going to make sure it doesn't fall in his lap. But your assessment is correct. Not just a deal, not just a great deal maker, but the first deal. This is right out the gate. The first one you're supposed to take on political wisdom or political convention says, conventional wisdom when it comes to politics says it should be a slam dunk. That's not what's happening with this president or this bill. So I agree with the professor's assessment that Ryan better be careful because the White House is already signaling that there are not enough votes in the Senate. You said speculation, so here's my speculation. This thing was dead on arrival from the beginning. It's not going to happen. Trump's going to distance himself from it. Ryan's going to take the weight for this. What that means in the House, I don't know yet.
Professor, we have some history when it comes to presidents and administrations pushing for healthcare reform successfully and unsuccessfully. And just remind everybody that it doesn't always go particularly well for the people in the White House. I mean,
all you have to do is ask Bill Clinton what happened to him in his first midterm election after the fiasco that was his attempt to push through a massive health care reform bill under his wife's tutelage. And it was a disaster for Bill Clinton, at which point he had to triangulate, which I think is what Donald Trump will eventually do, blame Congress for not being able to get their job done and move on to other things. But it can have a huge impact in the midterm election, which is already going to be difficult for the Republicans because they own the White House and the entire Congress. But in particular in this case, because this is such a personal issue for so many voters, as we've seen out there already, people will go to the polls on this issue. And just to back up what Dominic said, I don't think it's any surprise that while Paul Ryan is out there selling this bill, Breitbart is publishing inflammatory pieces about Paul Ryan. And I think it is a first salvo into what we're going to see as the blame game. If Paul Ryan doesn't get this thing pushed through, the White House will squarely place the blame on Paul Ryan, either directly or indirectly.
And whether this thing gets through or not, Dominic, healthcare and these kinds of things can really topple an agenda. I mean, go back to the Obama administration, who actually got a healthcare bill through, and that pretty much wiped out his agenda for the rest of his first term.
No doubt about it. The Republicans have to be very careful. I keep talking. What I'm trying to figure out, maybe somebody can answer this. I've been asking this from the beginning. Why in the world would the White House get behind this to begin with when they were not sure? But to me, it points to being a political novice. If you wasn't sure that the votes were there, why would you support something like this?
I think Speaker Ryan said, look, everybody wanted to see Obamacare change initially, and they were all on board until we offered a plan. And once we offered a plan, I said, oh, well, I don't really like that plan. It doesn't go far enough. But, I think he spoke to that.
That's a good way of putting it.
He said, listen, we all want to change, and we're all on board for the change, and then now we say, hey, this is going to change. It's, oh, no, it doesn't go far enough. So.
But Richard, the Republicans, from the presidential candidates to Senate candidates to House candidates to governors and state legislators, even on the local level, for 7 years have been campaigning on repeal and replace. And now that your party has the chance to actually do it, if you can't get it through, how is it not the gang that can't shoot straight?
That is exactly the point I was making. And that was the point that Speaker Ryan made to the Republican delegation. Said, you wanted to repeal and replace, we have a plan now, and now all of a sudden people aren't behind it. And look, some of it may be grandstanding. Again, it's not, the fat lady hasn't sung yet at this point in time. You know, we'll see what happens. The president is talking directly to the constituents who may be affected most by this change, and also who are represented, some of the conservative members of the Freedom Caucus, to hopefully get them to the constituents to pressure their representatives to support this plan.
Jeannie, I think the House Finance Committee votes on this tomorrow. It's one of the committees that's hearing this. John Faso is on that committee. John Faso's in a district. He won his race by 10 points. And he's in a district that Trump won by 6, but Obama carried twice before that. Leonard Lance from North Jersey, Republican, he won re-election. Clinton won his district. How critical is this vote for these Republican members in swing districts or in districts that actually voted for Democrats in the presidential election?
You know, I don't think at the committee level it will necessarily come back to haunt them in the midterm election, but I do think once they get a vote on the floor, and to your point, that this could come back to hurt those people. And I think that's why the House has to be very careful to count those votes, because the last thing Paul Ryan wants to do is oversee huge losses for the Republican Party in the House this year. And, you know, I think this falls under the heading of be careful what you wish for. And Mitch McConnell has said this. It is one thing to sit there for 7 years and to be the opposition and to say repeal, repeal, repeal. But this is a very difficult task to take on. And they don't have a replacement that they can come behind, let alone the entire country. That's a huge problem for them.
I want to go around the table on this on the last question. What's better for the Trump White House? Passing a bill that's unpopular and signing it into law, or not passing a bill that they've been pushing, regardless of its popularity, and not being able to get the campaign promise home that we would repeal and replace Obamacare?
Well, look, I would love to answer the question, but there's some variables. You know, this is the attorney in me. We don't know what the final bill is going to look like, so I can't say that sign the bill and pass it.
Given the hypothetical I just laid out, either they pass and sign into law an unpopular bill, or the bill, regardless of its popularity, doesn't get through Congress.
Obviously, we've seen what the results of an unpopular bill has done under Obamacare, so I would say you don't want to pass an unpopular legislation.
Dying Congress is better, Jeannie?
Dying Congress and blame, 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 which is what Donald Trump is good at. So he's going to come out okay. It's the House Republicans that are going to be in trouble.
A lot of blame coming, you think?
I agree. Do not pass a bill, because once you pass it, and if there are more people uninsured than there was under Obamacare, you own it. It's in your lap.
But don't they own it now? That was my
no,
first point at the
no,
beginning. They don't own it now?
Trump does not.
No,
Trump does
no,
not. I think Ryan does. Trump does not.
Right, Trump does not.
Okay, all right. Well, so
So
one
he's in the
of us
clear.
thinks he owns it now.
But remember, if that's tossed in your lap, you got midterms and you've got your re-election coming up.
First sign for those of you who are going to follow this along at home, they want to get this to the president by April, before members of Congress go back to their home districts for the next break from Congress. If for any reason they can't get it to the president by April, you'll know things are going not particularly well for Republicans. All right, up next, we've now seen another year of Donald Trump's taxes, but it's raising more questions than answers. It's also renewing the push to see more returns.